Preventing and Reversing Heart Disease. Part 1. Discovering the Endothelium. 1. Leading cardiologists have clinically demonstrated that vascular disease can be prevented and reversed without drugs or surgery. In this video, we will discover how and where vascular disease begins. 2. Autopsies of young soldiers from the Korean and Vietnam Wars demonstrated vascular damage present in all Americans by the age of 21, starting as early as 2 years of age. 3. It is now widely accepted that all males 65 and females 70 years and older who have been exposed to the standard American diet, SAD, a diet rich in red meat, dairy products, processed and artificially sweetened foods, and salt with minimal intake of fruits, vegetables, legumes, and whole grains have cardiovascular disease and should be treated as a heart attack waiting to happen. 4. During the World War II occupation of Norway, Norwegians markedly decreased their consumption of flesh meats, coffee, dairy, and alcohol. What followed was absolutely astounding. Norwegians experienced marked decrease in diabetes and cardiovascular disease when eating a simple, whole food, plant-based diet. 5. How? Why? Endothelial cells' key function is keeping blood vessels open by releasing nitric oxide, EDRF, causing vasodilation and increasing blood flow. Inflammation and deterioration of the endothelium is the foundation of many diseases, including peripheral vascular disease, dementia, cognitive decline, stroke, heart disease, diabetes, insulin resistance, chronic kidney failure, tumor growth, metastasis, venous thrombosis, and severe viral infectious diseases. Flesh meats, dairy, alcohol, and caffeine consumption all damage the endothelium, causing inflammation and damage within the blood vessel wall. 6. Key points. Statins prescribed to lower cholesterol as primary prevention of heart disease have a very small benefit. Fish oil does not prevent heart disease. It is essentially worthless for heart disease prevention. Caldwell-Esselstyn, MD. Low-dose aspirin use raises risk for major bleeding. Diet rich in meat, dairy, and processed foods cause a hypercoagulable state due to the damage and leaking of the endothelium. Cardiac and vascular disease is 45% of current Medicare dollars spent. Beta blockers do not treat causation of heart disease. Bypass surgery has a 45% failure rate within the first 12 to 18 months. What leading cardiologists are saying. There is a much more liberal use of angioplasty and stenting than there needs to be. Eric Topol, MD. Nothing. Not statins, not angiotensin receptor blockers, not beta blockers, and most assuredly not stents or bypass grafts, constitutes either a cure for coronary artery disease or is risk-free. Douglas Morrison, MD. In the last 15 years, Bill Clinton, our I Love Hamburgers president, developed severe heart disease and has had coronary bypass surgery and stents. After these procedures, he realized there was no other options. He faced a life and death decision. His cardiologist, Alan Schwartz MD, said, "This is not a result of his lifestyle or diet. This is a chronic condition. We don't have a cure for this condition." Clyde Yancy MD, a leading cardiologist, said, "This kind of disease is progressive. There aren't any cures." Are we predestined to be sick, overweight, and die prematurely? Can we heal a damaged endothelium and reverse vascular disease? Discover the cure. Watch Preventing and Reversing Vascular Disease, Part 2, the WFPB Cure. YouTube channel, Nature's Doctors. www.naturesdoctors.com